Year 9 Pass Assessment Task 2018 Sports Analysis by Mackenzie Davie. The basketball free throw is also known as the foul shot, as a player will take one when the opposing team has fouled while a player is shooting. Players are not defended during the shot, however, there is still a specific technique that needs to be followed in order to increase the likelihood of the ball going in the hoop. Key points of focus for this technique are the stance, including positioning of the head, shoulders, and feet, the transfer of body weight, key angles, including body angles and the angle of the arc, as well as bones and muscles that influence the trajectory of the shot. Stance and the transfer of body weight. During a free throw, feet should be shoulder width apart, square to the basket, and slightly staggered, with the foot opposite to the shooting arm slightly further forward. This helps provide balance. The professional uses this technique in their shot, but the amateur does not. They begin with the opposite foot behind the shooting foot instead of the other way around. This causes their torso to rotate, therefore putting the ball off-center to the basket, and causes a lack of balance which makes them fall forwards. The head and torso should stay upright and centered at all times, as it allows for a smooth shot and for the ball to keep an even distance when released. The amateur athlete falling forwards can affect the force in which it goes off the backboard. If there is too much force, the ball is more likely to bounce off in the opposite direction than bounce into the basket, decreasing the probability of scoring. In a free throw, body weight should stay evenly distributed between the balls of both feet. This allows the body to stay centered and can be seen in the professional shot. However, in the amateur shot, body weight begins evenly distributed but is later transferred to the right foot. This causes the athlete to jump to the right, which can change the direction of the ball's course. The course of the ball can also be affected if the shoulders are not squared to the basket, but both the amateur and professional are in their shots. Key angles during performance. Before a free throw, there are 4 body angles, which are the elbows, knees, waist, and ankles, that are important to the outcome of the final shot. The optimum angle for a shooting elbow is a right 90-degree angle. This makes it easier to release the ball in one smooth, fluid motion, therefore maintaining constant power behind the ball. In the professional shot, the angle of the shooting arm, 101.8 degrees, is relatively close to that of the optimum angle. However, in the amateur shot, the angle is too acute to be ideal, 32.8 degrees. In this case, the amateur would need to bring their arm back down before going up in their shot, disrupting the motion of the shot. The knees also need to be slightly bent in order for enough power to be put behind the ball. NBA player Stephen Curry has a pre-shot knee angle of 130.7 degrees and has an average success rate of 90% in his free throws. In this situation, both the professional and the amateur were very close to this optimum angle. In a free throw, the ankle should be bent so the knee is directly over the toes. This helps the athlete to balance during their shot. In the professional shot, the knees are almost perfectly over the toes, while the amateur's knees are slightly too far over. The amateur's slight imbalance could possibly contribute to them falling forward in their shot. The angle of the waist should be directly upright, as this also contributes to the balance of the athlete. In this shot, the amateur athlete, 127.5 degrees, is actually more upright than the professional, 115.2 degrees. The optimal angle for the basketball to hit the net is 45 degrees. In order for this to happen, the hands need to release the ball at a 50-degree angle. In this situation, both the professional 57.5 degrees and the amateur 60.1 degrees release the ball too early. This could cause both shots to gain too much height and fall short of the basket. The optimal angle for the shooting arm is 50.8 degrees for a player that is 6 feet, or 1.82 meters tall. Both the amateur and professional shooters are slightly shorter than this height, with the amateur standing at 1.77 meters and the professional being of a similar height. This means that their optimal shooting arm angle would be slightly higher than that of a taller player. The professional shooter has a shooting arm angle of 49.9 degrees, making the release angle marginally more acute than recommended. On the other hand, the amateur shooter has a shooting arm angle that is higher, 52.1 degrees, than the optimal angle, causing the shot to gain too much height and fall short of the basket. The back should also be completely straight, as bending forward can cause too much power behind the ball, therefore causing the ball to hit too hard off the backboard. As can be shown, the professional's back is almost completely straight, 174.9 degrees, whereas the amateur is bending slightly far forward, 158.9 degrees, which can decrease the likelihood of the amateur shot going in. After the ball has been released, the shooting arm should remain almost completely straight in the air, 85 to 90 degrees. This allows the ball to retain its arc. The professional shot is slightly smaller than recommended, but the amateur's arm is much too acute. This would greatly affect their arc on the ball. The knee should also be slightly bent during follow-through, which professional and amateur have both done. Influential bones and muscles during performance. There are multiple bones in the body that affect a free throw shot. In the torso, the scapula allows rotation in the shoulder in order for the ideal release angle of the basketball to be made possible, while the pelvis allows the body to be able to extend itself in order to get height on the ball. In the arms, the humerus, ulna, and radius extend in a smooth, fluent motion that creates arc of the shot. The carpals, metacarpals, and phalanges put backspin on the ball, which allows it to be able to spin forwards into the basket if hit off the backboard. These bones also affect the direction in which the ball goes. Bones in the lower body are primarily responsible for extending themselves in order to get more height on the ball. The most influential of these are the femur, patella, fibula, and tibia in the legs, and the tarsals and metatarsals in the feet. The main job of the muscles in the shot is to help extend the body. The deltoids, trapezius, gluteals, quadriceps, hamstrings, and ankle extenders extend the body upwards, which adds height to the shot. These muscles are also responsible for providing power behind the ball once released. Specifically, the biceps, triceps, and wrist flexors push the ball outwards, adding distance to the shot. Analysis of technique. The first thing I noticed between the professional and myself was the angles of the arm during the follow-through. The angles of my arm were much more acute than the angle of the professional. My head also fell forward when I shot, while the professional stayed in place. The other thing I noticed was that I jumped when I shot, whereas the professional didn't. This caused me to fall forward during my follow-through, which could have affected the direction in which the ball traveled in. There are 4 major differences in technique between the amateur and professional athlete. The most obvious difference is the angle in the amateur shooting arm pre-shot, as it is much more acute than the professional's angle. The benefits of having the shooting arm at a more obtuse angle is that it allows for a much smoother shot, whereas having a more acute angle means the shooter needs to bring the ball down before the shot to get more power. This lack of force makes them jump during their shot, whereas the professional does not need to. Jumping means that the arc on their shot is too high, which affects the probability of the shot going in the hoop. The amateur also tilts their head downwards and changes their feet positioning during their shot, which means they lose sight of the ball and lose their balance. As a result, it is much harder to control the ball, which could impact the likelihood of scoring. Overall, it would be moderately difficult to modify the amateur's technique. This is because most of the inconsistencies developed are done out of habit. The amateur would be able to modify their technique within a few months if they consistently practiced and used drills such as form shooting. These drills allow people to focus on and constantly repeat specific parts of their shot, such as the positioning of the feet. These drills could be used to correct all 4 major technique inconsistencies. The athlete could also regularly film their shooting in order to analyze the rate in which their shooting is changing and if they need to focus on anything specific in their shot. However, the best strategy they can use to protect their shot is consistent practice. You cannot change something if you do not make the effort to do so, and the same goes for this technique. Practice makes perfect after all.